Should you keep your appendix? What is the role of appendix in our body? Is it just a useless organ that periodically gets infected and requires its removal? Or is it a poorly studied organ that may have some benefits to our body? Welcome back. I'm Dr. Maria Azizian, a board certified general surgeon and IFM certified functional medicine physician. Today, we will be discussing a very interesting topic, a topic that's actually close to my heart, and I have a personal connection to it, which I will discuss later in this video. So we will be discussing this article that is called "The Useless Appendix is More Fascinating Than We Thought." So first of all, let's talk about appendectomies. So every year, approximately 300,000 appendectomies are performed in this country. And I remember in my training when I was a surgical resident, our motto was, when in doubt, take it out. What it means is that when there was ever question, for example, the clinical symptoms were equivocal and imaging such as CT scan and ultrasounds were equivocal as well, then we always erred on the side of removing the appendix. Of course, things have changed since then, and now I'm sure you have heard, or perhaps you were a patient where the situation was that you had appendicitis and it was not removed. So now there are certain indications where appendix is not removed in the case of appendicitis. But however, despite that, appendectomy is still one of the most common surgeries that is performed. And the interesting part in this article, in this research that summarizes various researches in this one article, is that there is now a link to appendectomies and to IBS, irritable bowel syndrome, and colorectal cancer. So there's a lot of emerging research. Interestingly, historically, just to give you a little perspective, there was an American physician, Miles Brewer, in 1928, who felt that people who had appendicitis had inferior genes and they had to be just let die. Of course, quite horrible. So then we have Charles Darwin's perspective on appendix, and he felt that it was a vestigial organ that is a remnant from how our ancestors ate. So it was related to our ancestors' diet, and it got switched from, they moved on from eating leaves, etc. So, and then since then, we were in a state where we considered appendix pretty much useless until recently. So now there is this emerging theory that states that appendix is actually a reservoir of beneficial gut bacteria. And as you know, we talk a lot on this channel about gut microbiome and how important it is in and responsible it is for our immune system. So other diseases that are being linked to appendix or to the lack of the appendix to appendectomies are ulcerative colitis, well, colorectal cancer, I already mentioned, Parkinson's disease, lupus, and even type 2 diabetes. So there are a variety of studies. There are small studies here and there. So, but they are all emerging with this very interesting message that appendix might be protective, may be helpful for us. So what is an appendix? Appendix is an outpouching, indeed a worm-like organ that comes off cecum, which is part of the large intestine. So, and aside from people, other mammals who have appendix are primates and rabbits. And there are some studies that have shown that mammals who had their appendix intact lived longer than the ones whose appendix was removed. And the theory was that appendix was protective in terms of devastating diarrhea because it was protecting these primates from having a horrible diarrhea. So another interesting study has shown that in young people, not primates, young people who have had appendectomy within 3 years, they were more susceptible to a certain type of salmonella bacteria that was requiring hospitalization for them compared to young people who have not had an appendectomy. So then this theory that came in the early 2000s by Dr. Parker, who felt that appendix is a safe house of beneficial bacteria, which is closely correlated with the immune system. And they also did some study that had shown that people who have had appendectomy had less diverse gut microbiome, especially when it comes to beneficial bacteria. And as you know, in our conversation about gut microbiome, the more diverse it is, especially in terms of the beneficial bacteria, the better it is. So we want to have a diverse gut microbiome that actually is a sign of health, sign of healthy gut. The next theory, or the next sort of label or definition now that some theories are trying to put on the appendix, that appendix is has a role in training our immune system. Appendix has these immune cells that are called M cells, and those M cells, there are scouts for various bacteria and viral infections. And what they do, they present these infections. I'm speaking in a very simplified version right now, present these infections for immune system to attack them. So basically, again, appendix has a protective role according to this hypothesis. So now moving back to colorectal cancer and Parkinson's. With Parkinson's, there is some data that shows that having appendectomy may be a trigger. Causality is not clear yet, because I wouldn't go as far as they say that appendectomy can cause Parkinson's. I think that would be a huge leap. Let's put it this way. There is a correlation. And that makes sense to me, because we've talked on this channel that Parkinson's is now looked at as a disease that starts in the gut, and that there is a correlation between issues with the gut microbiome and the leaky gut and Parkinson's. So if the hypothesis that appendix affects our gut microbiome is true, then it is true that there is some causality or some correlation or triggering of Parkinson's disease. So it makes sense to me, but again, more research needs to be studied, because there is also some study that has completely opposite results, that shows that people with appendectomies are less likely to develop Parkinson's. So it's not all clear. There is a little bit more data between correlation of appendectomies and colorectal cancer. It is believed that gut houses this beneficial bacteria, as I mentioned earlier, and when something happens with our colon, such as diarrhea, and all the bacteria is flushed out of the colon, appendix initiates this repopulation of beneficial bacteria, and by that it is protective of colorectal cancer. So very interesting. So my personal connection with this was that when I was a surgery major medical student, that was my project, actually, to find a correlation between appendectomies and between the incidence of colorectal cancer. And I chose that topic myself. I was very interested in that. I don't know why. I still find it very fascinating. And I did analyze many, many charts. At that time, a lot of these older charts were not computerized. So you had to go to the medical records and sit and look through tons of charts. And my findings were that there was actually a small prevalence, higher prevalence of colorectal cancer in people who had appendectomies. So I'm proud of that little research. So we'll see. I do think that this makes sense, but more research is necessary. So in conclusion, I would like to summarize this article that summarizes many other articles inside, that appendix may be a protective organ, that more thought should be given to its removal. And it's not like when I was in training, when I mentioned that when in doubt, take it out. Yet, at the same time, as a surgeon, I have to say it that, I'll try to put it mildly, well, sometimes you're not in control of your appendix, because there are situations where appendix is so infected. For example, when you present with an acute abdomen, which means a severe abdominal infection that requires immediate surgery. And at that point, preserving appendix honestly would be the last thing on the list. And I would not worry about that, because saving somebody's life from a life-threatening infection is number one concern. So saving appendix could be considered if somebody has a very mild appendicitis or questionable situation. There are actually now guidelines according to which we do not operate, and perhaps we will discuss it in another video. But essentially, with a life-threatening infection of appendix, we have to do what's right. So thank you so much for listening. Until next time, bye-bye.